Can we move on the next slides for Phuong's presentation?
Good morning, dear distinguished guests and colleagues. It's my pleasure to join the 14th Highland Newcastle PPL International Symposium. Today, I would like to share with you the topics e-PBL pilot application during pandemic COVID-19 at Huế University of Medicine and Pharmacy, Vietnam. To start my presentation, I would like to introduce about myself. I am a nursing educator and clinical physician at Huế University of Medicine and Pharmacy and its medical center for nearly 20 years. My major is child care. So I completed my master on pediatrics in 2009 and my PhD degrees on medical research and international health in 2017. I really like teaching and research work, so I'm very keen on new teaching learning methodology. Luckily, I had chance to join a nursing education project with Korean Nursing University since 2015 and start with PPL, e-PBL, flipped learning, etc. Also, I have opportunity to join this PPL symposium from 2014 up to now. It's so great to join this academic network and I learned a lot of useful knowledge. About COVID-19, as you may agree with me, at the beginning, no one among us can imagine how traumatic situation that SARS and COVID-2 or we call COVID-19 bring to our personal and global life. It is considered as the worst disaster with nearly 5 million people infected and 1.2 million deaths. Since the first case reported in Wuhan, China on December 2019, now it's spread out to 260 countries and territories, with US, India, and Brazil now is at top 3 highest infected countries. By its severe impacts, the world has been suffering a loss from COVID-19. Many consequences on society, economy, education, and health were reported and increased day by day. About the COVID situation in Vietnam, we reported the first case on January 2020 on a Wuhan man and his son. The total number of infected cases now is 1,203, mainly came back from epidemic areas, with 35 deaths in multi-precondition patients from Da Nang Hospital in the second wave of COVID-19 in July. We have now 40 city provinces get infected cases over the total of 63 cities and provinces of the whole country. Actually, Vietnamese government had a successful response to COVID-19. Evaluation from the report Imaging COVID-19 Success Story, Vietnam's commitment to containment reports in the Exemplar in Global Health Platform, they recognize the key factor to attribute to this success story, including a well-developed public health system, a strong central government, and a proactive containment strategy based on comprehensive testing, tracing, and quarantining. But I have to tell that the totalist agreement and voluntary participation of our people plays the most important roles to this success and give us a bright hope to face the next wave of COVID-19. I just want to list out some of our government response approach. Among these, the most successful approach are contact tracing, targeted lockdowns, and clear, consistent, creative public health messaging. This chart is describes the third degree contact tracing in Vietnam that were informed publicly. As I mentioned in previous slide, national lockdown and mass quarantine is an effective way to control COVID-19. In this diagram is the data of total people under quarantine in Vietnam. The highest number is in April with about 85,000 people. With very proactive but strict approach, the daily lives of organizations and people in Vietnam has been affected a lot, especially the conventional schooling such as in our university. The University of Medicine and Pharmacy was founded in 1957 and now develops as a training center of medicine, pharmacies, and allied health science. Its main mission is to train and provide the health staff for the Central and Highland of Vietnam. Currently, UMP is a top 3 largest medical university in Vietnam and was recognized as a pioneer on medical education reform and accreditation. Here is some facts and figures related to the human resource organization structure of UMP. The university has about 11,000 students for undergraduate and graduate training programs, with about 2,000 graduates per year. For the school year 2019-2020, follow the guidelines and regulations of the government. We almost close on direct teaching and learning activities. The alternative teaching approaches is online teaching. We use our own learning management system, Google Classroom, e-PBL cloud system, and also use some applications such as Zoom, Meet, Microsoft Teams for teaching. And I would like to share with you the online teachings on PBL case. Problem-based learning has been applied in UMP since 2000 for preventive medicine education. Since 2015, PBL has been applied for nursing education under Jeju Halal University supervision. English, from 2015-2016, the scenario were introduced to the student on paper with direct group work. On 2017-2019, the scenario was first introduced to the student on tablets with ubiquitous-based learning system. And from 2020, based on the COVID-19 situation, the scenarios were first introduced to the student online using e-PBL clouds and application Google Meet. We have developed 5 PBL courses on fundamental nursing, medical adult care, mother and neonatal care, child care, and nutrition and dietetics. Here is the materials and the class activity for the year 2015-2016 on PBL applications. In 2017, we applied ubiquitous-based learning system to develop the scenario and put in the tablet. In which way the scenario have a more fruitful information with multimedia like video clips and etc. And also the tutor have a more information and more convenient to manage the cost. In 2020, in the situation of pandemic COVID-19 and online teaching application in UMP, so we transfer the PBL into online PBL via e-PBL cloud system and Google Meet for the group discussion. We applied this course for the nursing student, anesthesia nursing student year 3 in the second semester for the subject child care, in June 2020. This is the timetable for the course. English, we have letters, PPL group discussions, presentation, and course reviews and evaluations. This is the e-PBL cloud system that we create the course on childcare and use PPLs online. This is the letters, images, and video in the course online. And children in the course, we prepare to create the account for the teacher and student for registration inside the course. For teaching procedure, this is a face-to-face orientation that we introduce the course, introduce the PPL methods, introduce the e-PBL cloud system, and also do the course registrations for the student. As you see on the screens, many of our students to register to the course by their smartphone. The main part of the PPL teaching is the PPL tutorial groups, and here is the staff for the PPL tutorial groups in our course. Firstly, we divide class into two groups. Each group has one tutor and one tutor assistant. Second, we provide the PPL scenario to students on PPL cloud system at the morning of the PPL group discussion days. Next, the tutor assistant will set the meeting course on Meet application and inform to the tutor student via Zalo group work. The fourth, we have a PPL group discussion for the first scenarios in which we identify the learning objective. And the fifth is the student to do self-study, and tutor will provide some key lecture through the online system. After the student have a self-study phase, they will submit their presentation on e-PBL cloud system, and then we have the group discussions the second time to present the first scenario and also introduce the second scenarios. After that, we will repeat step 5 and step 6. And at the end, we have the group discussion, the third one, when we present the scenario 2 and feedback and course evaluations. In the screen, we provide the materials, the scenarios first in the e-PBL cloud system. And in the second picture, this is the meeting code for the class was set up by our assistant and shared via Zalo group work. This is the group discussion for introducing and discussing the scenario 1. This is the key letter. When students complete the key letter, it will become green and marking as complete. So we know that the student has been complete the letter already. This is the place when students put their presentation as assignment before that they have the group presentation. This is the group presentation for scenario 1 from the student after they finish the first tutorial group discussion, have a self-study and have a key letter. So now they have to prepare and present for the report for scenario 1 what they have from their learning objective. The second part of the second tutorial group is for the introduce and discuss on scenario 2. This is group's photo at the end of online PPL group discussion. As you see that even as we are doing the class in the evening time, but all students are very excited and feels very convenient with the system. During the course on e-PBL cloud system. We also provide the forum that students have at the time and arrange their chatting discussion about the case before they can have the group presentation. Also that the tutor can be join them and also give some comment and feedback. This is the system, this is the path for us to follow and see the achievement of the student. We also can provide some quiz or maybe question, short assessment for students also. And this is the photos from the code reviews and evaluation via the function chat and go live in e-PBL cloud system. So for the learning lesson from what we have a pilot application, we found that it's really a friendly system, easy to access and very flexible with the using device like a smartphone, tablet or laptop. And also it's very flexible on time management, which very most convenient for in-service students who still working and study at the same time, so they can find the good time for them to join the course. Some tips that we mentioned here is a TLT training, train the trainer for course developer, for tutor, and for the student to how to use in systems smoothly. The second one is that we should have a face-to-face orientation at the beginning, especially for the new user. If we get familiar with the system and with the methods, we will have a knowledge to this, but at the first time, it should be very important to have a face-to-face meeting. And one tip is that we should rotation the position of the group leader and scribe to enhance the capacity for the whole group of students, not only for one or two persons, but all of them have the opportunity to be the leader or to be the scribe and practice their skill. If you have any questions, we are very willing to answer you. I would like to complete my presentation by the comments that I have ever read. Yesterday, the COVID-19 had brought the world to its knees. Global collaboration, cooperations, and fair governance are key. This is time to leave the competition behind and work together as one human family. Thank you very much for your listening.
Thank you for your great presentation of experience of e-PBL operation. I'd like to invite questions from audience. So please leave the comments and questions regarding the presentations. Then we'll give the answer from speakers and further discussion in panel expert discussions soon.